Hi, my name is Aryan, and I want to reflect on a patient encounter from earlier in my rotation that gave me a clear understanding of OCD and the role we play as psych NPs. The patient was an 18-year-old male with obsessive compulsive disorder. He described needing to count, wash, and check things repeatedly to ease his anxiety. One behavior that stood out was how he had to make things feel even, like if he touched his right shoulder, he'd have to touch his left one too, or if one step felt off, he'd repeat it until it felt balanced for him. These weren't just habits, they were ways to relieve intense discomfort, ways to relieve his anxiety. Even though these rituals were clearly interfering with his life, he did not fully recognize how much they were holding him back. And that really highlighted the importance of psychoeducation, helping patients understand not just the diagnosis, but what's driving the behavior, which is anxiety. People often confuse OCD with just being overly organized or overly neat, but that's actually more common in obsessive compulsive personality disorder or OCPD. The key difference is that OCD causes distress. People know the thoughts and behaviors don't make sense but feel compelled to do them anyway. OCPD, on the other hand, involves rigid perfectionism that usually feels normal to the person, even if it causes problem for others. And that's an important distinction when it comes to treatment and communication. One of the strengths during the session was being present and observant. I noticed while he was very calm and how he spoke, his body language, like his fidgeting and constant knee bouncing, suggested a lot of ongoing anxiety internally. I stayed grounded and supportive, but also realized I held back from asking more direct questions about his intrusive thoughts. And that's something I want to work on. Learning how to explore sensitive topics in a way that feels safe and respectful. This case reminded me that OCD is about much more than what people see. It's the anxiety behind the behaviors that needs to be understood and treated. As psych NPs, part of our job is to guide patients toward effective treatment like CBT with exposure and response prevention and to help them feel safe enough to talk about what they're experiencing. Now, going forward, I want to keep building my confidence in assessment and communication and continue to develop the kind of presence that helps patient feel understood and supported. And that's it. Thanks for listening.